I'm going to talk a little bit about magnesium today because magnesium is one of the most common nutrient deficiencies or mineral deficiencies that I see in my practice. And the reason that most of us are deficient in magnesium is because it's not in our food supply like it used to be, because our soil doesn't have the magnesium content that it used to have. Signs of magnesium deficiency, there actually are many. So the most common signs and symptoms that I see of magnesium deficiency include constipation, because magnesium is important to help bowel motility. And then there's also muscle tension, muscle cramps. If you feel tension in your neck, if you are clenching your jaw, teeth grinding at night, or just overall just feeling tight and achy, sometimes that can be a magnesium deficiency. Also, magnesium is important to calm the mind down. And so if you feel overly anxious but aren't sure why, that could be a magnesium deficiency. And also it kind of calms your whole body down and your mind down to be able to sleep at night. And so if your sleep is disturbed, a lot of times supplementing with magnesium can help too. The question though is, which magnesium do I choose to supplement with? Because there are a ton of magnesium options out there. I'm going to talk about 3 today. There's even more than that, but the 3 that I commonly recommend include magnesium citrate, magnesium glycinate, and magnesium threonate. So we'll talk about magnesium citrate first. Citrate, and I'm not talking about the kind that comes in the bottle at the pharmacy. If you're getting the liquid stuff, that's a whole nother deal. I'm talking about the capsules, and the capsules are more of a daily supplement that we can take. So the capsules of magnesium citrate typically come anywhere from, I think I've seen them as low as 100 milligrams all the way to maybe 500 milligrams. So you really want to pay attention to how much you're getting, because this stuff can work. And if you take too much magnesium citrate, you're going to go from constipation to diarrhea. But magnesium citrate, ideally, if you take it at night and you just start with a lower dose and then you increase up as you need to. And again, do all of this under the guidance of a medical professional, because you want to make sure that this is right for you. But the goal would be to take the magnesium citrate at night and have a normal, easy bowel movement in the morning. So that's magnesium citrate. It can also help a little bit with sleep and with relaxation, but more so with the bowels. Magnesium glycinate helps more with muscle relaxation. So it can help a lot if you're having tension headaches or jaw clenching or muscle cramps, or if you're having a hard time sleeping at night. This is a great supplement to take. So I tell oftentimes when people are struggling to sleep, that's one of the first supplements that I'll recommend to take at night, to see if that'll help calm down the mind and the body to be able to sleep better. Magnesium glycinate doesn't have as much of an effect on the bowels, so most people can take it without having the side effect of diarrhea, unless you're really sensitive to magnesium or to supplementation. The third magnesium I often recommend is called magnesium threonate. And magnesium threonate is the only type of magnesium that can cross the blood-brain barrier, meaning it can really help with anxiety or with calming your mind down. And so this is one of my first options to tell people to supplement with if they're experiencing mind racing or anxiety, is considering that it may be due to a magnesium deficiency in the magnesium threonate. And you can take this in the morning or at night, or a little bit of both, to help just calm your mind down, calm your racing thoughts down. It actually can also help with headaches too. And so that one, again, really isn't going to affect the bowels as much. It's going to instead it's going to affect things that are going on in the head. So those are the 3 magnesiums that I commonly recommend. And again, I would recommend supplementing with a mineral well before trying to take Advil for a headache or trying to take a laxative for constipation. Something to really think about when you are having symptoms, especially these types. Really ask the question, could I be magnesium deficient?